Hello and welcome to Atmia's podcast. Today we have with us Vivekanand Murthy sir and we will be discussing about licensing exams for MBBS students studying in Georgia. Hello sir.
Hi, how are you?
Nice. My first question is what is FMGE exam and why is it mandatory for foreign medical graduates?
The medical education system in India is vastly different from many other countries. When we say foreign graduate, there are 5 countries like US, UK, New Zealand, Australia. They don't have to write FMG when they come back to India because they're necessarily mainly English speaking countries. Canada, I left the fifth one. So these countries, if you're studying MBBS, you need not write any exam. But the rest of the countries, NMC, National Medical Commission, feels that the standards are very different, and unless until one is tested properly, they cannot treat the patients in India. The first requirement for any medical graduate who comes from abroad is to crack FMGE, qualify in that, and then go for a 1 year internship and then practice in country. So FMGE, I also feel, is necessary in this country.
Okay. And who conducts FMGE exam?
National Board Examinations along with NMC, National Medical Commission. These two together conduct FMGE. It's conducted twice a year, in the month of December and in the month of June. So I can talk about the test pattern. What's your next question?
And what is the exam pattern?
Okay, the exam consists of 300 marks. The first 100 marks is about preclinical and paraclinical. Next 200 marks is about clinical subjects. Therefore, there are 300 marks that is there in the examination. It's a completely digitally computerized examination. You have to write on a computer. 300 MCQs, multiple choice questions.
Okay. Is it any passing criteria for that?
Absolutely. 50% marks is required to pass in the FMGE. That means you need to score 150 marks out of 300 to clear FMGE and be eligible to practice in this country.
It is observed that the passing percentage of FMGE exam is low. Is it true?
Yes, because people are going to several countries. There are certain universities and countries where the passing percentage is as low as 10 to 30%. Normally, if any university can give you more than 50% of pass grade, that university I consider to be good actually. Unfortunately, the passing rate is low, but however, one can write any number of times.
Are there any common mistakes students make while preparing for FMG?
You cannot generalize like that. Number of students don't even bother about it till the final year. They concentrate on subjects which are not very important. There are subjects, like I told you, the clinical subjects get 200 marks, whereas the other subjects, paraclinical and preclinical, they consist of 100 marks. Therefore, the weightage is more on the clinical subjects. If one can concentrate more on the clinical subjects rather than the non-weightage subjects, he'll get more marks. That is the first mistake they do. In Rajasthan National University, for example, where I come from, we train students for FMGE from the day one, year one, whichever subject is taught. In that, some FMGE related questions are given to them, and preparation for FMGE is starting from there itself. So one needs to start from the first year. You can't keep all the subjects till the end, come back to India and start preparation for FMGA. This is the mistake students do. While they are studying, they have to keep a big notes for them. They have to keep all FMGA related questions into that notes and start writing them for subjects like anatomy, physiology, the non-clinical subjects or the clinical subjects where they are going to go. It's very important for them to prepare from the day one and prepare for a longer period and then have a fast preparation at the end of the day. They cannot prepare. And secondly, they go to different sources. They believe every source that's available. Today's world technologically is so advanced that everybody is giving his own material on the web. You should not get into so many sources. You should have one reliable source and start studying from there. Or get into some senior doctors, some professors, ask them, take their help and get prepared. So it is necessarily to take help and prepare for the exam. Then your pass percentage would be 100%. For example, a couple of years back, our pass percentage was 63 and then it's growing year after year after year. We're aiming at a 90 plus percentage of pass percentage in the first attempt. In various attempts, number of people, all 100% people should be clearing the exam.
Okay. Are there any specific study resources or strategies that are best for cracking FMG exam?
The best strategy is to study every subject properly and get good marks in your MBBS, wherever you are studying. Once you have a subject knowledge, once you have a grip on the subject, there is no other source that is required. Number one. Number two, they have to believe in their professors. Get the advice from them, get the tips from them, let them teach them, discuss with them, interact with them, understand what FMGE is right from the beginning, and then get from that point of view, study from that point of view. It's easy. Thirdly, you depend on your medical college more than anything else. There are a lot of sources. Is there any best source? Nothing like that. There are a number of sources that help you, but the best is the medical college that you study in, the professors that you have an advice with. We at Jharkhand National University strongly believe in training the students for FMGE from the day one.
Okay. As we all know that Georgian MBBS students get clinical exposure. So this clinical exposure affects the preparation of FMG exam?
Yes, it helps a lot because 200 marks from the clinical subjects. So the clinical exposure that you get in this university is far-fetched and then extremely helpful for people to clear the FMGE examination. It's a long distance walk kind of thing. Regularly they get exposed to this and they clear the examination actually. So yes, it does help a lot.
If any student fails in FMG, how Atmia education helps them?
If he fails, most of the people they complete, come back to India, write the examination, and if they fail, and if they approach us, we organize special tuitions for them through the same faculty that's in Jharkhand National University or University of Absena, and then help them to clear the FMGE free of cost, no extra expenditure. But if they don't approach us, we just cannot help it. So one thing we must understand is a student can write any number of times provided he is qualified properly.
Okay. And how Atma education helps students in preparing FMG exam and increase their chances of passing that exam?
First of all, let's understand once again what is required to write FMGE examination. You must be a qualified doctor in a recognized country, recognized by WHO and all. Number one. Number two, your degree should be recognized, your MBBS should be recognized in the country, your institutional degree should be recognized in the country that you study. They have to recognize you. And you must have done an internship that's recognized again. You must have valid degree certificate, valid passport, and all these documents. If a particular country requires a registration for you to become a doctor, that registration certificate should also be there. Several countries do not require this. If you fulfill all these countries and all these conditions and write FMGE, you are qualified for that. Atmia helps students to ensure that everything is met with. That's point one. That means if you are studying from any of our universities, you are 100% qualified to write FMGE unless until you did not clear NEET. Okay, that is point number one from Atmia. Secondly, we have integrated the program with FMGE, with USMLE, with UKMLA. So whatever you want, you can write. Whatever you want, you can choose and start preparation for that right from the first semester. So it is immensely helpful to students to get into the integrated program and prepare for these comparative examinations.
Is there any age criteria for this exam?
No, there's no age criteria.
Does Atma education helps only in the preparation of FMG exam or other licensing exams also?
See, most of the Indian students who come to Jharkhand National University or SU universities, their goal is to come back and write FMGE and succeed. Therefore, that is number one. We prepare them seriously for that. But other than that, there are a number of students who come to Jharkhand National University aspire to do their masters at universities in USA. USA requires USMLE, which is a three-step examination. USMLE is step 1, step 2, step 3. Our students start their preparation for step 1 in the first year itself. There are a dedicated number of students, a percentage of students who want to do only USMLE. For them, we have an American trainer who comes and trains them for USMLE. In fact, we have a strong association with Kaplan, world's biggest and best organization for training students for USMLE. So we have a different system for those people. Only they need to come us and tell us that this is what we want. There's a small, very little small additional fees for a dedicated batch. But otherwise, if you also want to prepare for USMLE, there's no fees. So you are taken into a separate classroom, an American teaches you, and you prepare for USMLE step 1. The other two steps, step 2, step 3, you need to go to US and write. We prepare them. By the time they complete their 5-year, 5.8-year MBBS, they are fully prepared for USMLA step 1, step 2, step 3. Same is the case with UKMLA. We have special classes for them, what was called as PLAB, and today what they're calling as UKMLA. We have a similar system. Therefore, we definitely prepare for these two. Now, if somebody wants to go to Germany or some other countries, there are a lot of other rules. They have to learn the languages. They have to do it on their own mostly. But we show them the way, we guide them how to go about. In a nutshell, we prepare for FMGE, USMLE, PLAB or UKMLA right from the first year onwards.
Okay. Thank you, Murthy sir, for throwing some light on this FMGE exam and other licensing exams also. Thank you so much.
Thank you so much. Any student, if you really want to reach us, please reach us in the following numbers. We can help you clear your FMGE examinations. Thank you so much.